Hello, everybody. My name is Tomo Okubo. I'm a social protection specialist at UNICEF headquarters, and I'm joined by Hugh.
Hi, everybody. Yes, this is Hugh Simon, Director of the Global Social Service Workforce Alliance.
And we will be jointly presenting on the topic of strengthening the role of the social service workforce in the social protection systems, which is a work that UNICEF at global, regional, and country offices and the Global Alliance of Social Service Workforce has been working together. And I just wanted to acknowledge that Aniruddha Kulkarni, the child protection specialist from UNICEF, has also contributed to this work, but due to his availability, we are presenting on his behalf as well. So I will introduce what is the rationale of us jointly looking at the role of social service workforce in social protection systems, and then I'll hand over to Hugh on practically what that means and what kind of recommendations there are to further strengthen the role of social service workforce in the social protection systems. I would like to start by reminding us global commitment that the nations, the national leaders, and civil society leaders, all of us has made to address poverty and social exclusion. So you've already seen in the image the SDG goals that were committed, which includes ending poverty, reducing inequality, promoting health, education, skills development, as well as strengthening access to justice and ending violence. And to achieve all of these goals, which could look ambitious, but a very important foundational commitment that global leaders and all of us have made, is that we are not leaving, no one is left behind, and we are focusing those who are the most furthest behind, who are most vulnerable, facing different various risks, but also have limited access to different support or services. And when we look at those who are most left behind, and when we look at those that are most vulnerable, we cannot tackle these problems and these multiple SDG goals that are interrelated without combating the structural causes that is driving them to be living in poverty or dropping out from education or having health issues. We believe that these issues are interconnected and are structural to a large extent. So our presentation and the way we see social protection system and social service workforce responding to these is how do we combat the structural causes? How do we bring multiple services support together to approach and reach these goals? And just to also emphasize that since this goal was signed and agreed in 2015, the world has actually seen a backward trend in terms of many indicators that were here. Part of it because of the COVID pandemic, there are different conflicts, climate change impact that are happening, and we're definitely not on track, which means the need for social service workforce and social protection to be scaled up and strengthened is even more an increase. So we have seen that in the pandemic, those who are already poor and vulnerable were made extra vulnerable during the pandemic. Those who escaped poverty has been pushed back into poverty, or those who became new poor because of the pandemic and the social economic impact. And needless to say, these pandemic, conflict, and climate change are bringing multidimensional impact, non-income impact. So it's not only about losing money or having economic challenges, which was also major, but it's affecting all areas of children's and people's rights across education, health, abuse, neglect, mental health issues, family care, and reduced access to services. So there are various approaches that are needed to achieve these goals and respond to holistic needs of children and families and individuals. But today we're looking at it from the perspective of social protection and especially focusing on the role of social service workforce. So social protection is defined globally, and UNICEF takes this definition as well, as a set of policies and programs that are aimed at preventing and protecting all people against poverty, vulnerability, and social exclusion throughout their life cycle, with emphasis particularly on the vulnerable groups. And there are various programs under social protection system that include social transfers, which is cash transfer, it can be in-kind transfer, tax credits, social insurances. So there are contributory mechanism to it and support people protect from poverty or vulnerability through health insurance, unemployment insurances. Then there are labor and jobs market programs, including family-friendly policies and livelihood programs that support income at the family's level. And as a connector, we will be zooming into the role of social service workforce as part of social protection system. COVID was a big wake-up call to many governments, many internations, that economic protection, social protection was critical to be expanded in response to various shocks to protect children, families, and individuals from the risk of poverty and vulnerability. But it's also clear that it's not only the economic dimension that we're looking at, and thus we are going to look more in detail of how social service workforce can bring together different support to address a multidimensional vulnerability that children and families are facing. Over to you, Hugh.
Thank you. Thank you so much, Tomo. So just to take it from there, I'm just going to explore a little bit more from the point of view of the social service workforce. How can the workforce come in here to try and address these multidimensional problems that Tomo was just describing? So obviously a multidimensional poverty is a multidimensional problem and therefore requires multidimensional solutions. And specifically here, we're talking about linking cash that can be provided and increasingly has been provided to families on a regular basis, both regular payments and emergency payments during and after the pandemic, how to link that cash support with additional services. And that way the dimensions can work together. And when that happens, there is evidence that the positive impact is multiplied and more long lasting, and it can involve reducing poverty, violence, and social exclusion. So it could be what sometimes is called cash plus or cash plus care, or cash plus care plus protection, if there are protective services involved for individuals or children who are at risk, as well as the support to the family or the individual. So those kind of plus services, those services that get added alongside the cash support, can involve access to retraining, job finding, small business grants and other livelihood interventions, counseling and support for parents and young people, family support that includes parenting programs, mental health support, substance abuse, protecting women and girls from abuse, exploitation, protecting children from violence, and just other interventions to improve the overall living conditions and the housing situation that can't be remedied simply through those cash payments. So this requires, this approach that we're talking about, this multidimensional approach, that requires two workforces to come together. In some countries, at the very community level, there's only really one worker or one representative of the social welfare system. But generally speaking, at national level, you have two types of workforce that really need to come together to have more of an integrated cash plus services approach. So on the one side, on the left of the diagram, you can see the people responsible for administering that cash, for assessing and then delivering and monitoring the cash, often called administrators or social assistance administrators. Their work is low labor, high intensity in the sense that they're working across a sort of one person might be working on 500 or 600 cases. So many people repeating one action or one or two actions in terms of getting people through the process. It's therefore quite cost effective because you have a relatively small number of staff getting money out to a relatively high number of people, and it can be there large and quick to scale up. And it might have a fairly low capacity though to address individual differences. So it's basically one solution. It doesn't necessarily have the capacity to flex to individual needs. Whereas on the other side, social work is quite different, where the benefits administrators are working on a low intensity level on a wide number of cases. The social workers and the wider social service workforce, which includes paraprofessionals and sometimes community volunteers, they are probably all trained and supported and tasked with much more high intensity work with a smaller caseload. So not 400 or 500, but maybe 20 or maximum 40 cases at one time. They need a high capacity to target individual needs and dynamics. So it's labor intensive, it's about case management, working on specific cases, connecting those individuals and families with the services that they need, as well as directly supporting them. And so it's slower to build up that approach, and it can be slower to scale up, but it will be required even if there were not cash. It's standalone, but it's particularly more effective if it comes alongside cash services. So this diagram here is quite a good representation of the complexity of trying to get the right people in the right places. So that means matching the functions to the competencies. So making sure the things that people need to do to deliver the cash plus the services, they have the right competencies for that work. And the people with the right competencies are in the right places to deliver those key functions. So the diagram, without going into it in too much detail, is trying to represent from the bottom up. We have people working with just a very basic qualification to people working with a certificate, a diploma, and a more advanced professional level. So the diagram goes up vertically, but it also goes across horizontally, because you can see a whole range of different roles, people working on employment, social insurance, rural development, youth work, community leaders. There's a whole range of different roles and functions within this wider workforce. And then on the other side of the diagram, on the right-hand side, you can see other sectors that the workforce needs to collaborate. So there's quite a lot of horizontal and vertical integration that we need to get clear on. And we need to be clear on the differentiation of functions and the different competencies required at the different levels and the different specializations. So all this needs to be done to strengthen the way that the social service workforce can work in social protection. So there has been a lot of discussion, and I'm particularly indebted to my colleagues in UNICEF in the East Asia Pacific region, where we've been working on these projects, because they've helped us explore this particular issue of digitalization of social protection. So during the pandemic, there was an acceleration of use of digital tools to get cash available more easily to more people, so they can access through mobile banking and on their mobile phones and other electronic applications. So the question that we explored together with our UNICEF colleagues in that region and some case studies in a number of countries there was, does this digitalization also mean that to some extent the human face of social protection is being eroded? So is there less contact now between people, between those who are working in this area and the beneficiaries? And so what we found actually is that this is not necessarily the case, because there are opportunities and strengths in digitalization. You have electronic payments reaching more people to reduce cost and corruption. You have online application systems and making it easier to apply without having to line up, in a long line of people, which also can be difficult and stigmatizing for people. So you can do that in the comfort of your own home if you have, of course, if people are online. Also, there are ways of having online training and education for the workforce, and there's many ways of getting counseling to people and direct support to people using the phone as well as online. So there are generally a lot of benefits and efficiency gains, and also reduced administrative burden, not having to do all that paperwork. But on the other side, there are some constraints and challenges in being more digitalized. It does reduce the face-to-face opportunities for contact between social assistance workforce and the people they work with. And some beneficiaries that are being targeted may not have access to digital methods. We're very familiar with the digital divide, and that is a big problem in many countries. So it might be that just one person in a rural village has a mobile phone, and it quite be difficult if you have to explain your circumstances to that person to put you into the system via their mobile phone. There isn't much confidentiality there, and you're reliant on the person who has the connection. And also there are a number of constraints. So traditional methods of contacting and communicating with vulnerable people, they continue to need to be used. So to mitigate those constraints, we still need to continue the traditional methods of communication. So just to say, well, who is doing all this work? Well, in the Global Social Service Workforce Alliance, we have this broad concept of the workforce, which is inclusive of government and non-governmental professionals and paraprofessionals, working with a wide range of people, as explained here. And at multiple levels, as the earlier slide mentioned, it's multi-level work, which is both preventive, it's also responsive, and it's also promoting wider solutions more through advocacy and working on a macro scale. So they're engaging people in a whole variety of ways, as explained there on that slide. So we have this inclusive concept of the workforce. it includes a wide range of practitioners, researchers, managers, educators. At its heart, there is social work, but there are also other categories of professionals, social pedagogues. There are paraprofessionals and paraprofessionals who may not have a degree but have specific training. And so this range of specialists with different levels of training need to come together as one overall workforce, in much the same way that the health workforce is not just doctors, but it's nurses and a range of therapists and other people that need to come together for an integrated workforce. There's a link there where you could find out more on the socialserviceworkforce.org website about information on how we define these roles and titles. So this diagram illustrates that a bit more clearly, that we have a workforce under an inclusive umbrella, which includes a range of job titles that you can see on the left and right there, providing preventive and responsive services, but also promoting the work more widely at the level of the individual and family and the community and the national level, or what we call the micro level, the mezzo level, and the macro level. So we have a framework for strengthening the social service workforce that we have developed together with UNICEF and other partners. And it's very much focused around first planning the workforce. So how many do you need in what roles, what competencies, developing the workforce with training, education, and strengthening curricula and faculty to teach the workforce. And then ongoing supporting the workforce with systems that will sustain the workforce through the difficult jobs they have to do, make sure they have adequate working conditions, and support professional associations to keep the workforce working well and promote the ethical standards within that profession. All of that having to be adapted to the specific country context. So it's not a one size fits all. These three wheels will have to turn all the time, but inside the wheels will be very specific elements that are unique to each country's context. So finally, we have a few recommendations that, across the board, there need to be a number of things done to strengthen the social assistance and social service workforces in social protection. And the first is around planning, establishing a national strengthening, workforce strengthening working group to bring people across sectors together. They can together map what is already there. So map the functions and the required competencies. So what do we have and what do we need? And what kind of skills do those people need, or the broader competencies? We need to look at the numbers. So how many people are needed, with what level of skill and training, in what places, and in what area of the system? And then you can have a target workforce to population ratio. From that, you need to develop a clear vision of the workforce, that its functions and its deployment. And a key part of what we're talking about here is that there is no wrong door. In other words, we don't want to turn people away. We don't want to have a workforce which is stuck behind their desk saying, no, sorry, you've come to the wrong office. If you need that kind of help, you have to go over there and you'll have to find it on your own. The no wrong door approach is really about having social service workers like the woman in the diagram. She is working alongside somebody and she will stay with them until they receive the help that they need, or until her family receives the help that they need, rather than just passing them off to somebody else. So that is a very labor-intensive piece of work, but we need to invest in that sufficiently to build up the competencies and the capacity, including things like access to vehicles and transport, so the workforce has the time and the resources to go out and engage with people in their communities and in their homes to make sure they have the services that they require. So that's also about training and professional development, and ongoing training and education needs to be strengthened, as well as having performance management policies and systems. And it's about supporting the workforce in the face of quite difficult working conditions, advocating for better pay and conditions, making sure they have quality management, but also crucially supportive supervision, or technical supportive supervision, which makes sure that they have one-to-one guidance and can reflect on the difficult cases that they have, and can also develop in their professional capacity. So they're not just getting oversight from a manager, they're actually getting support, and that they're helped on their career pathway, and to reflect on the most difficult work that they have to do. So that's all areas of support that they need from their manager, from their supervisor, but also from a professional association. And finally, monitoring and evaluation is of course crucial within a wider M&E framework to make sure that we can identify and process the outcome indicators that tell us how well this work is progressing. So that, in a nutshell, is our presentation. Thank you so much for joining us today. Sorry it was a bit of a rush, but I hope some of you will be able to download this recording, but by all means contact us. And you can find our contacts and further resources on the socialserviceworkforce.org website. And there's a lot of information about UNICEF's social protection work as well, I'm sure that you could find. So that's all from me. Thank you so much. Tomo, do you want to say a final
No,
word?
nothing to add. Thank you so much.
Thank you very much and all the best. Goodbye.